So thank you all for joining our conference call, our stakeholders call. My name is Adam Rosenberg. I'm the Executive Director of Baltimore Child Abuse Center. It's March 11th, 2015. We're delighted by the number of callers who are on this phone call. Some of them are new. Some of them are returning. It provides us with an opportunity every couple months to be able to share our developments, our progress, and our achievements, and sometimes even our challenges with you, the people who invest in us, who care about our work and want to be able to work with us to build a safer, better community. You should have by email a PowerPoint slide deck and also a link that you can join us online to be able to follow the presentation as it goes along. So hopefully that works well for you. And this will be available to watch along afterwards. So let's get started. There we go. I wanted to just briefly first give you an update on the adverse childhood experiences study that we spoke about at our last call. It was, I sometimes joke that we are ahead of our time, but we really were in this case. That we've been talking about ACEs for a while, and we gave all of you, our listeners or stakeholders, the opportunity to understand what ACEs was last time and to take your own ACE quiz. But National Public Radio is running a major series on this topic over the next last week and this week. The first of the stories is hyperlinked here at this blog, NPR story in their health department about family secrets making you sick, and the notion that the same things that we were talking about that we learned from Dr. Anda ourselves, that adverse childhood experiences do have poor outcomes later in life for people. And it gives people an opportunity to take the ACE quiz. So for those of you who participated last time and followed what we were doing with the ACE study, you can say that you're already aware of it because of what our work has done. And I think this is an example as to why this sort of work is so critical with understanding adverse childhood experiences there. As I always like to do with these calls, just want to give you an update as to some of our numbers that we've seen in 2014, the calendar year, which ended. We were able to do our final data analysis, and we saw there were a total of 937 children who were referred to Baltimore Child Abuse Center there. And some of the statistics which are included in our service report is included. But there are, some interesting to note is that 37% of our cases, over a third of our cases, were referred to us after hours. I mean, it's really become a critical part of our service delivery to be able to meet children at the time that they need help, rather than having them wait until the next business day. And that commitment to after hours also extends, frankly, this winter has been a long, brutal winter. I hope you've all survived it. But, it impacted operations around here that we would find ourselves, last week we were closed simply because of the snow, but our ability to serve children was not closed. We have an on-call team who is available every day, including snow days, and they come to the office to be able to respond to these issues of abuse. So that after-hours program is just so critical for everything that we do. Moving through it also, though, is that, look, most of the children we see, almost three-quarters are under the age of 12 years old, and most people who have offended a child are known to the child. This is not stranger danger, and we have the numbers to prove it. Many of the children receive referrals for services there. We've got a number of children who are in intensive long-term support. That number will grow over the next year as we receive funding from a variety of foundations to be able to expand that service considerably. And we also, do a lot of other work besides the forensic interview. We have provided medical examinations and mental health assessments there. But one of the numbers that we're really most proud of, frankly, in a lot of ways, is the numbers of professionals trained there. I mean, you can see over 3,000 people receive some form of training, and that's been really important to us in our efforts to be able to help the community learn how to prevent abuse themselves. And much of this professional development was really around working with police officers and social services workers and teachers and summer camps and institutions and it just continues to cement our position as being able to be a leader in leading that being a leader in that conversation about giving people tools to prevent abuse there. One small footnote, perhaps, but really important to these 44 girls is our Divas program. We had 44 teenage girls who've been through trauma themselves, experiences a great program that we've been running for 5 years now called Divas, Developing Inner Values to Acquire Success. And it really gives these young women who've been through trauma the communication tools to succeed. So that program continues to be a warm, wonderful program that if you ever have the chance to hear some of these stories, and we'll try and find ways to share them with you, are really heartwarming. One other footnote before I get into some of the agenda we shared today is we're also in the process of doing an assessment of this building. Baltimore Child Abuse Center is located at 2300 North Charles Street. It's in a lovely building. It's one of the old Goucher College dorms. The building itself is well over 100 years old, and for your architecture buffs, it's one of the old Stanford White buildings as part of that original Goucher College neighborhood. It's got a lot of history, and it's a beautiful building. However, with an old building, as many people know, come a lot of the hassles that are with it there, and we're coming to a point where we really need to take a assessment as to this building and what needs to happen with it. Small things like, not necessarily small things, but issues like HVAC units are continually needing to be replaced. Our windows are 75 years old. Our access is limited. A rear elevator doesn't work. And then there are more important short-term needs in terms of security to be able to make sure that our visitors and our staff are as safe as they can be there. We're doing a security assessment in the coming weeks, so we believe that we'll be able to get some concrete plans in place to be able to address some short-term security desires that we have as we look to make this the safest environment, but also a space that's still comfortable for kids. We don't want to necessarily make it a police state where kids are worried about it, but at the same time we want them to feel comfortable here. That will ultimately lead to some long-range questions about the building itself and whether this is truly, whether we are at a point where we're ready to seek out and raise the money to do a capital project to make improvements to the building, or do we need to start to consider alternate locations for our program now that we've been here for 10 years. We're certainly a very different program now than we were 10 years ago. So we'll keep you apprised and posted on that, but it's certainly something that's important to figure out where we go. And from any other business stakeholder, it's important to share with you how we're doing. Financially, our revenue is up 18% over the previous year, and we're doing really well. I mean, we reviewed our projections last night at our board meeting, and our revenue is up, and our projections are well on pace there. One of the things that I think is a little bit frustrating, we're trying to understand our workplace campaign through United Way. It's just one of those numbers that is just difficult to assess from year to year. But we've developed, we've done really well with grants, restricted and unrestricted grants, as well as our Be a Hero event, and that has more than made up the difference there. So our legislative update, I wanted to share some of our legislative efforts in Annapolis, the session there. We have a lot of partnerships. So, throughout the year, we meet with a number of legislators, delegates and state senators, and as well as our U.S. representatives. We've had well over a dozen meetings in the last several months with our elected officials to let them know and to provide them with advice and guidance on different issues that they may face. We also held a private briefing for the Senate Education, Health, and Environmental Affairs Committee in Annapolis this past January at the request of Senator Joan Carter Conway to be able to brief the committee on the adverse childhood experiences study there, so that they have an understanding and awareness of these same issues as well as they're dealing with education and health issues, which is what ACEs impacts. We work with the Committee to Protect Maryland's Children. It is a coalition of other youth-serving youth advocacy organizations like ourselves that is headed up by advocates for children and youth. One of the benefits of that is it gives us the chance to talk with other organizations that have an interest in this field, and we can debate these issues and to come to some consensus and work as a coalition. And hopefully our strength is in our numbers, and that the 10 to 15 organizations that support these bills through the CPMC have a little more weight in these different committees there. It also benefits us by sharing some of the responsibilities. so that Baltimore Child Abuse Center doesn't have to be down in Annapolis on every bill. We share our responsibilities and our duties with everybody, so that we'll write some testimony and we'll appear to testify in some bills, but other members from the CPMC do so as well. So it's a very good partnership that helps us stay on top of it. And we certainly want to give some appreciation to both the Venable Law Firm, who has taken us on as a pro bono client, as well as the Krieger Fund for Change, who continues to support our advocacy efforts in Annapolis. Real brief, there's a number of bills, probably about a dozen bills or so that we've weighed in on this session there, supported either with written testimony or oral testimony through either on our own or with the Committee to Protect Maryland's Children there. Most of these bills generally deal with the failure to report abuse and our continuing commitment to improve mandated reporting systems. We really believe, and there should be an article coming out in the Baltimore Sun today or tomorrow, addressing mandated reporting systems and the failure to report issue there, and just the need for Maryland to be doing better with mandated reporting. I mean, frankly, there is no penalty for the failure to report abuse in Maryland, and about half of these bills address that system there to be able to provide the training for the teachers or the educators and the social workers to be able to do that, and a structure in place so that if there is a failure to uphold their legal responsibility to report abuse, then they can be held accountable either by the criminal justice system or even by their own licensing board. One of note that is a difficult bill that we've opposed is Senate Bill 526, the Maryland Second Chance Act of 2015. By no means is it to suggest in any way that we don't support the concept of the Second Chance Act. It is truly a very important bill to be able to let people who have been convicted of minor misdemeanors that second chance. But the opposition has come from the fact that in the bill's drafting, and we I guess oppose it with the suggestion that we would support it if the amendments came through, is that a number of youth-serving organizations like ourselves and CASA, Court-Appointed Special Advocates, non-governmental agencies that were working with youth would be precluded and restricted from being able to do an appropriate criminal background check to find if their volunteers are in fact convicted sex offenders, child abusers, domestic violence, etc. The things that we want to be able to, that we need to do in order to keep these children safe. I believe at some point that bill will become amended and will become law either this session or next session once those necessary amendments are in place. There doesn't seem to be much opposition to be able to open that up a little bit wider, but I did want to point that out there because it's certainly challenging to be able to oppose something that is going to help many people get back to work, and we know that work obviously directly impacts much of abuse and neglect out there. I mean, we want to give people jobs, frankly. But we want to make sure that we can still continue to even, it would prevent ourselves from being able to conduct a background check on a volunteer or an employee here at the center, and that was something that we wouldn't be able to find acceptable. I wanted to transition this over to something about Darkness to Light. Darkness to Light is our brand new prevention initiative that I think builds upon the 3,000 people that we trained last year through different organizations, and now lets us take a community effort in our prevention efforts throughout Baltimore and the region as well. There is, on this slide, there's two links that are definitely worth watching. The first link is from ABC 2 News. There's a video. Hey, Jenny, if I click this link, are we going to be able to, will there be audio shared with the participants if they're watching? Probably not. So there's a nice story that ABC 2 News ran on this, which gives a good overview as to what we're doing there. And obviously the second link is to Darkness to Light's website. We've been looking at Darkness to Light and other prevention programs like this for several years now. Darkness to Light's been around since about the year 2000 and is really one of the first national programs that has been developing training for the community on helping elicit a response to preventing child abuse. And over the last year, almost exactly a year to the date, my staff and I met with representatives from a number of different national prevention organizations and began to look at their curriculum and vet it and see what curriculum really made the most sense for Baltimore Child Abuse Center to use. What was the most modern, what was the most up-to-date, what was the curriculum that truly, I think, fit our needs and fit our philosophy as well. We wanted something that looked good, looked professional, and was something that we'd be proud to support, as well as an organization that was going to be supporting us as well in our efforts there. And ultimately, we concluded that Darkness to Light was that organization there. The William and Irene Weinberg Family Foundation gave us a nice grant to be able to launch this, so this didn't cost us anything additional to be able to run a training this past month for 10 facilitators on our staff who will be trained in this and now can go out and run a series of trainings in the community. And as I will probably say later on in the conversation, that you can be trained too. I mean, one of the next steps is, from here, inviting us out, and whether you want to be trained as a trainer or whether you want to host a session where we talk about this issue with you, this gives us those tools and that opportunity. Carrie Freshour, who's actually on the call, thank you, Carrie, and Colby Simon are also the chairs of this effort. They've been trained in this. They're passionate advocates in this area there. Carrie comes to us by way of Portland, Oregon, where she was working in a child advocacy center out there, and really took this to keen issue there. So we're developing this to be an important part of our work. Darkness to Light's program is really based on the foundation and the belief that overcoming child sexual abuse really requires us as adults to change the rules and the systems and the structures surrounding children so that every child's potential can be realized. For those of you who have been listening to these calls for the last year or so, I mean, that should come as no surprise that it's always been our contention that children can't realize their success if they have been victims of abuse, if they've befallen one of these adverse childhood experiences there. And Darkness to Light has that foundation that I think to let children reach that potential there, we've got to change the system. And the real focus in Darkness to Light is not about a curriculum for children, but is about empowering adults and using evidence-informed practices over the last 15 years that it's an adult's responsibility to protect children. Quite often, we're always perplexed that the child didn't tell us what happened, and that we were always ready to listen, but the child said nothing there. And I think that what Darkness to Light does is it gives us as adults better tools to be able to listen to children, to look out for what's wrong, to be able to minimize abuse in the neighborhoods and the communities there, and frankly, a lot of the things that we've been espousing in our own professional development there. It also teaches adults how to recognize and react responsibly to it. One thing, so again, there was a real alignment in philosophy here. When adults react hysterical about a report of abuse, then similarly the child will very quickly shut down because they realize what chaos they've wrought upon their household there. So we need to be able to react responsibly. But along with reacting responsibly is how do we react responsibly within our own communities and our environments? How do we set up systems in place so that adults minimize their own risk and the risk of potentially stupid things happening along the way, that children aren't put in harm's way through situations that can lead an adult or lead to an accusation there. It is generally unrealistic to expect that children will fend off the offenders. Quite often when we've run trainings and different sessions, I will draw upon the grand jury testimony in the Jerry Sandusky case because the witnesses, the victims of Sandusky, would quite often say, and they would share this range of emotions that they had when they dealt with Sandusky, and that they'd be confused and perplexed by the fact that here's this man giving them all these privileges and then taking advantage of them and putting these children into these adult-like situations there. And it was really, telling to be able to read that testimony and to be able to look at a lot of what happened with Sandusky and to recognize that this is happening, on a regular basis with all these children across the country there. These are children who, it's not even a matter of physically being able to fend off the offenders, but being confused and perplexed by the relationships that adults are trying to foist upon these children there. Slide stuck. Here we go. There are 5 basic steps to protecting our children that Darkness to Light espouses there. 1 is learning the facts. 2 is minimizing opportunity. 3 is talking about it. 4 is recognizing the signs. And 5 is reacting responsibly. And again, it's funny to see this, packaged in that same way that we've been saying it for the last several years as well. None of this, frankly, is rocket science. I mean, it really is about, some just a good packaging, a nice basic framework that Darkness to Light, lets us do for the community at large in a very attractive package that they're also looking to work with us and co-brand it with us there. So they've often said, and even that ABC news story, I think, is telling in that they recognize that we should be able to use the Stewards of Children training and the Darkness to Light program to be able to further our own efforts to protect children. This isn't about Darkness to Light raising money for itself. This is really about a tool being available for us to do the best work for the community there. But I think the 5 steps is also reasonable to be able to take a look at, in that it's not really difficult work to be able to protect children. That there's some very basic things that we can do to protect our children by learning what child abuse is and minimizing those chances and those opportunities for things to happen. And so, just by having this conversation today, we're talking about it, and that goes a very long way in preventing abuse from happening there. And so ultimately, how do we make prevention a priority? We can eliminate this. That I think we equip you with these tools, and we address urgent needs to protect, and we empower people that they can do this. This isn't so difficult and so challenging to do, but is relatively easy to accomplish there. Darkness to Light uses real stories. What's been really attractive about their program is that they have videos from survivors and from family members and from community members where the system failed. So I think learning from past mistakes and trying to do something good with that. And those are real-life examples of how we can make a difference there. What really stood out in our minds about Darkness to Light, though, after we saw the training, was they gave practical advice as to how to present this delicate material. It's a typo there, but this delicate material in a sensitive manner. This is really hard to present. You'll have audience members who often disclose, get triggered by something that happened there, and you don't want to send someone out in the field who is not a social worker necessarily or a trained professional to deal with crisis to talk about abuse and then have to deal with the situation afterwards. Darkness to Light makes sure that not only are you presenting the material in a smart fashion, but also presenting it in a responsible fashion there so that you can deal with the after effects. And that's really, really important to be able to do that. It also makes sure that the presenters know how to present this well. So it's not just about giving people a PowerPoint deck and saying go forth, but training them on how to be trainers. And that stood out above every other training that we've ever worked with there. We're forming a work group, so you're welcome to join us on it. We've got some board members, we've got some staff members, but we really welcome you, our community partners, to be a part of this work group. We would love to have members from the foundation community and from hospitals and schools, that it's not just about us who've drank our own Kool-Aid here, but people who really are committed to this in the community and can help make this practical. Religious leaders, people who want to work with us there. So you're welcome to join us. You can personally get trained. You can be trained to become a trainer and run these things with you, and we will provide the support for you on this. We think it's really important that we think it's really important that people get trained on this manner here, and that they can go out, because we need people to go out and do this with us. You can also host a Prevent Now event, a real informal conversation amongst the community. Invite us to your home, invite us to your work, invite us to your church, your synagogue, your Girl Scout troop, and let's talk to parents about this, and let's talk to them about how do we prevent abuse from happening there. And this program integrates beautifully with our professional development efforts and our community outreach. We're really pleased to be able to do it. As we wrap up, I just want to remind people that our Be a Hero event is on April 30th from 6 p.m. till whenever it ends. Robin Quivers is our featured speaker. If you haven't bought your ticket, you've probably got about a half hour left. There's only 20 tickets left, so by all means, contact Jenny Trust. I'm going to open the phones for any calls. Anybody has any questions that they want to ask. Otherwise, we're going to wrap up. And if you're a fitness nut, on March 28th at the